What's up, guys?
You want to tell the people at home what you did?
Well, so it happens, I'm the first injury of the trip. It's a little gash. I was working on our fireplace over here, trying to barricade some rocks in front of it for kind of like spark arresters, because we almost had a little mishap last night.
Yeah.
But
that was because we had like an 8-year-old kid here with us that
he likes fire.
He likes fire, yeah. We had
to, like all 8-year-old boys do.
Yeah.
So, anyways, turns out it was granite and it was already cracked. So when I went to roll it over, I gave myself a nice little gash.
Peekaboo!
Went through, luckily shallow enough that it wasn't a gusher.
Yeah.
So I was able to kind of go into my basic little first aid kit and start cleaning it up and at least get some gauze on it to slow down the bleeding.
Josh is like, hey dude, you got your first aid kit? Yeah. Didn't think that it'd be a rock that would make the injury, but here we go, guys. I'm trying to convince Josh into letting me suture it, but I think he wants to just go with butterfly closure. So I'm gonna hand the camera to Josh, and he'll videotape what we do, so you guys can see it.
Give you guys an idea of what you should do when
not cut yourself.
You do have when someone in your group or you happens to get an injury. No, I don't particularly want stitches. I hate needles. Now, I'll put my own IV in. I'll draw my own blood.
I hate needles too.
But,
by the way, are you allergic to iodine?
No, sir, I'm not allergic to iodine.
Like
very important thing, you know, me being conscious and have my wits about me. I know I can now tell, in this case, Chappy, our
medic for the day.
On-site nurse.
Oh, what a jerk.
Our on-site medic. If I am allergic to anything. But there's nothing in that med kit that I know that he would have that I happen to be allergic to. Well, not allergic to anything other than his bad humor.
Bad humor, yeah. That's something to be allergic to, that's for dang sure.
It's a pretty nice one. Kind of went deep.
Yeah, it did look like you got it pretty good, didn't it? Luckily,
yeah, I'm glad it didn't go any deeper. Because it was actually the larger part.
Yeah.
And it wasn't as sharp. The small parts were like razor blades.
Yeah, you're lucky.
So yeah, no, I'm very fortunate. Okay, we're back, and
we got things squared away now.
Now that we got things squared away, so if you're ever gonna go in someone else's med kit, word of the wise: if you take time to do a nut up or shut up.
Yeah, then we're gonna use the med kits from Total Resources International. Oh, do you want iodine?
Thank you, guys.
Or betadine? Let's go with iodine.
Iodine.
Ooh, hang on. You got shit in here.
I got all kinds of stuff in there.
Alright. Turn your wrist this way. Oh yeah, you got a few little knickknacks in there. You're not allergic to latex, right?
Nope. God, I hope not.
Well.
Because otherwise I'd be in big trouble now.
I know, huh? Well, it's good to ask those questions so that people that are watching whatever bit of video we get for them know. You always want to ask your patient if they're allergic to latex, what allergies they have to medications. With Josh, I don't ask him who he slept with.
Now, while he's kind of getting ready to clean my cut here, kind of take a look at these med kits. They're from
you ready? Turn your... Dude, you got in there pretty good.
They're from Total Resources International. You've got a little bit of everything. They're your real common red bags that you see in a lot of stores. I found them everywhere from Target to CVS to Fry's, everywhere. And they're a real nice comprehensive kit.
Dude, we rarely should stitch this, but we should be able to get away with. But you see, you got. Is that hurting?
No.
Burning at all?
Yes.
You got debris in there.
Yeah, I know.
We need to get that out.
Yeah.
Hang on. Bring that down so I can take a look at it.
Yeah, you able to kind of scrape along the edge, outward. I know you don't want to really pull it open more, but...
Yeah, but... Dude, that's some fatty tissue in there.
Yeah.
You don't have hepatitis, syphilis?
I'm clean.
Good. That's another thing you want to ask your patients. Especially since I'm not wearing a face shield. But with Josh also, all of my guys I trust immensely. So I know that they are clean cats and characters. Okay, no Q-tip in here. You know what? That is a good reason why we have the big bag here, isn't it? And if you guys notice, I didn't use the fingers that I was, because I've already gloved up. Alright, dude.
Not gonna like this much, am I?
Probably not.
Oh, start to bleed up again.
You say it's starting to bleed up again?
Yeah.
That's alright, we want it to bleed.
It's good, clean blood, so.
And we want to thank the great folks down at Total Resources for supplying us with our med kits, except for the big one. The big one is built by NSS. Dude, I'm sure you're gonna feel this. On that, and what did we decide on?
Iodine.
Iodine. You ready?
Yes.
Here it goes.
So it's deep enough for stitches, huh?
It could be. I said so. He said
Oh,
no.
no, that's a good one. Stitch that.
He said no.
I say stitch.
I
didn't realize it was that big when you were working on it, dude. You're trying to hide that from me.
Because he didn't want it stitched.
I don't.
He doesn't.
He's showing me his surgical kit and stuff.
The youngster doesn't like stitches.
He's all, oh, that thing got me.
I think the youngster would just rather not get stitches from the old man.
I'd rather just not get stitches, period.
He doesn't think I have
well,
good.
Chappy, look at the edges on that thing.
I know.
Oh, yeah.
He doesn't think the old man has good stitching skills. Is that thing still recording?
It's still recording.
Oh, it's a good thing we brought that thing to charge the battery, huh? Oofda.
I don't care about your stitching skills. I don't like.
You almost dropped the
I
F on
almost
there,
did.
didn't you, sunshine?
Sorry, guys. I just don't flippin' like needles.
Hey, I could hit you with catgut or monofilament, either one. I could put in a nice little, chingadera stitch. No? We don't want that? You want to go with butterflies? We can go with butterflies and then we'll just have to tape over it.
That's fine with me.
Alright.
I'm sure that'll be just
Hey,
fine.
Anthony, give me some help here, Bubba.
Yeah.
You want to...
Here.
Let me sterilize my hands first.
Yeah, that'd be great.
Where's the bios?
Bio wipes. There's some sitting on top of the crapper over there.
Oh, there we go.
Alright, let me show you guys a trick here. Taking my gloves off. Pinching them. Rolling them. Holding it. Rolling them inside to each other. I hate.
Yeah.
I hate Metro gloves. I hate latex gloves. I hate gloves. I've had my hands inside more sucking chest wounds without gloves than I have with gloves, and I'm disease free. I guess there's something to like the fact that when you see somebody bleeding to death, you don't stop to glove up.
A nice little clean towel to dry off.
Yeah, to glove up, you just jump in. All right, how you feeling with that, dude?
Fine.
Yeah.
What do you need me to get out?
No, pack up that. And that needs to go into the...
Alright, where are we going? This goes
surgical kit goes in there, iodine, and goes into the... Yeah, on the outside. You know what I mean? There you go.
It was just sitting right in the top there. It was just sitting right in the top.
Okay,
you seriously just want to do butterflies? Okay.
Yeah, I do.
Dude, this is a nice freaking pack.
Let me see that. Is it... Stop bleeding. I'm going to give you a 3-in-1 antibiotic.
Good one.
I know, huh?
See how those butterflies hold up. Need a painkiller?
Nah.
I got some in my bag.
I don't even feel anything.
Okay.
So.
I got it from my heart attack, so.
All right, here, Anthony, you want to secure that,
And then.
Oh, this is all being video.
Yeah, that's right, man.
Oh, yeah.
Is that your spitter?
Yep.
That's a loaded spitter, man. I'm glad I'm not the only one. Again, hey, another again to you know, Total Resources for having the optimum first aid kits.
Oh.
Yeah, we try to get him to let us stitch it, but he's not into needles, so.
Yeah, if it was on me, I would let you stitch it.
Well, go cut yourself.
I'm cool. I don't need to go. I don't need it. I don't have
Go
to
cut
have
yourself, sunshine. Sounded like cold steel next to my head.
Yeah, it was. The recon. Field moment. Barry, hand it to me. I'll burn it.
No, I got that because I need to sterilize that too.
Okay. You gonna need more of anything else for first aid that you need?
You know what I'm gonna do? I'm gonna make sure that sucker's
Antibiotic.
Triple antibiotic, and now I'm searching for some steri strips. Let's just do steri strips. You hold that, Bubba?
That'll do.
Hmm?
That'll do.
Yeah, but we're gonna use this wonderful goop right here too. It's like skin super glue.
Yeah. New skin. That's great.
Tincture of benzoin.
Who don't like a good tincture?
You know what? I'm gonna have to glove for this too.
Yeah, you have to.
Hang on. You got that?
Yeah.
This is gonna be dirty.
Rumor is that stuff feels pretty nice.
Yeah. The tincture of benzoin?
Yeah.
No, you don't. That's not like new skin where you seal it up.
Oh, okay.
You paint lines with it. It adds a. Hey, don't try to scare him.
Like a membrane?
Burns.
Like Josh is gonna be scared of that.
I don't care for new skin. I don't think it does the trick.
New skin sucks. Super glue works.
Super glue works way better.
It does, but.
Which we would use, but that's a little bit bigger than a super glue.
Yeah, it's a little bit bigger than super glue.
It's a little bit bigger than a super glue.
I just picked up super glue before we got up.
Okay, we're gonna have to cover that too after we put this on.
Yeah.
All right, bring your arm this way. Let's clean up that wound. Yeah, Anthony, you want to grab? Is this empty?
Nope.
Or Nick, can we get you to?
Yeah.
That's so
What do you need?
Just grab this
Hold it up.
and this stuff over here. Oh, I just need you to hold this box now. And then we'll burn that box so we get rid of all the bio. There's let me see this. feel closer to me now, Josh?
I do.
Made you yellow, dude.
Iodine.
Good old iodine. This stuff. Now this is going to be a first for me too. I haven't used this good goop yet. For external use only.
Ooh, look at that. Let's get a close-up of that. Yummy stuff. Let me come in on that.
Now this is supposed to be some wacky tacky here. And because we're using that only on Josh, we can stick it back in the pack. And burn it all.
Yeah, it actually does a little bit when you're applying it.
Burns?
No, like just barely.
Just a little numbing burn.
Yeah,
Alright.
that's alright.
I have the same kit as you.
Yeah. What, in the field?
Yeah.
Yeah. Alright, this stuff is like extra glue. Feel that? Look at that. Doing, 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 doing.
Oh yeah, it's got a nice grip to it.
Okay, let's close this sucker up. So, close. There we go. Anthony, I need the surgical kit that you put away.
Would this tool work?
No, I need a pair of scissors.
Right in here.
Hold that
Oh.
close right there. That's okay, Anthony. You got that, Josh?
Yeah.
Should be a pair of scissors right there.
That's a nice kit.
Alright, lift your finger. Lift your finger in the back. Okay, you gotta turn your arm towards me. Just close that sucker up.
Better than Henry Mayo.
Shit, I don't know about that, but make it work.
Now, what do you paste some of that stuff over it?
Yep. Get into the wound. See if you can move your hand. Alright, you're going to have to be really careful with that and baby it for a while.
Alright.
Because you got it in the wrong spot, dude. Alright, let's bandage that sucker up.
Who's that?
Okay, so what happened here, Josh got himself cut. We got everything taken care of. You got that box, Bub? We got it all taken care of. We got a couple of steri strips on his wound.
Let's see this little dressing right here real quick.
So we got a little tincture benzoate under there with some steri strips holding it on. Gauze with some tape to cover that up and protect it until everything kind of dries and settles in with, you know, the triple antibiotic.
And Anthony had to pause shooting because there were trespassers on the property at the same time. That's kind of funny, man. But, we good? We good?
We are good.
Alright, guys, that was just, you know, hope you guys found it entertaining. I did.
Something you normally don't ever see in like your typical survival or, you know.
Yeah, we didn't open up a case of bullets and take out a slug and pour the black powder in there and just burn it closed, did we? Dumbasses. We could have. You want to do that? Shut up.
You know.
Yeah.
No, I'm okay. I think I'm good.
You sure you don't want us to burn it closed?
I wouldn't even let us stitch it.
Nah, I'm okay.
But he'll be fine, so.